They will be broadcasting from the nation's capital in Washington, D.C. Democratic presidential rivals, Senators Barack Obama and Hillary Clinton, traded barbs over their health care proposals while campaigning in Pennsylvania this weekend. The rising cost of medical care has emerged as a key concern for voters, particularly as the economy continues to worsen. A new survey by the AFL-CIO found almost all the respondents, most of whom were insured and employed, thought the current health care system is fundamentally broken and plan to vote for ways to change it in November. This is an exchange between Clinton and Obama on health care from their debate in Los Angeles on January 31st that was hosted by CNN.
We cannot get to universal health care, which I believe is both a core democratic value and an imperative for our country, if we don't do one of three things. Either you can have a single-payer system, or, which I know a lot of people favor, but for many reasons is difficult to achieve, or you can mandate employers. Well, that's also very controversial. Or you can do what I am proposing, which is to have shared responsibility. Now, in Barack's plan, he very clearly says he will mandate that parents get health insurance for their children. So it's not that he is against mandatory provisions, it's that he doesn't think it would be politically acceptable to require that for everyone. I just disagree with that. I think we as Democrats have to be willing to fight for universal health care.
What they're struggling with is they can't afford the health care. And so I emphasize reducing costs. My belief is that if we make it affordable, if we provide subsidies to those who can't afford it, they will buy it. Senator Clinton has a different approach. She believes that we have to force people who don't have health insurance to buy it. Otherwise, there will be a lot of people who don't get it. I don't see those folks. And I think that it is important for us to recognize that if, in fact, you're going to mandate the purchase of insurance and it's not affordable, then there's going to have to be some enforcement mechanism that the government uses. And they may charge people who already don't have health care fines or have to take it out of their paychecks. And that, I don't think, is helping those without health insurance. That is a genuine difference.
There are important differences between the health care plans offered by the Democratic presidential opponents, but neither of them is proposing a single-payer system of national health care. That's despite the endorsement of precisely such a plan last December by the American College of Physicians, the largest medical specialty organization. The candidates' refusal to consider such a proposal also flies in the face of the latest study indicating a majority of physicians, 59%, now support government legislation to establish national health insurance. Today, I'm joined by Dr. Rocky White. He's a passionate, if unusual, advocate for a single-payer health insurance program. He describes himself as a, quote, evangelical from a conservative background. He's on the board of directors of the nonprofit Healthcare for All Colorado. Most recently, he revised and updated Dr. Robert Lebeau's classic book advocating single-payer health care. It's called Healthcare Meltdown: Confronting the Myths and Fixing Our Failing System. Dr. Rocky White joins us now here in Denver. He just came up last night from Alamosa, Colorado, where he lives. Welcome to Democracy Now!
Thank you, Amy.
It's good to have you with us. We just drove through on our tour through New Mexico and Colorado, Alamosa, yesterday morning, and we're reminded of the problem with the water. Before we talk about health care, can you talk about what happened to Alamosa's water?
Well, several weeks ago, we started seeing sporadic outbreaks of salmonella in the community, and before too long, those sporadic outbreaks began to grow and grow, and it finally became clear that the salmonella was in the city water system. By the time it was all said and done, we've had about 300, I think I saw in the paper yesterday, 385 cases now of salmonella, and just recently we had one death. Thankfully, that's all that we've had, but that's basically what happened. We really don't know the source. We don't know where the breach came from. We had a horrible winter, and so it could have been just the freeze-thaw from the exceedingly frozen ground, and then probably a breach somewhere with the high sub levels from the amount of snow that we had. I suspect that's probably where it came from, but I'm not sure we'll ever know.
I had heard there was some pipe work that was being done and possibly sewage pipe mixing with the water supply. Is that at all? What could have happened?
Yeah, there's a lot of theories out there. I'm not sure that we'll ever know for sure. But the city was intending on chlorinating the water at some time in the future, but that future is now. So we now have chlorinated water in Alamosa.
And people are drinking it now.
And people are drinking it now. You know, it was really tough, Amy, for a couple of weeks. People couldn't take baths, couldn't wash their dishes. And, you know, obviously the thing that happened there was the effect on the economy has been devastating. Most of the restaurants had to close down. People got laid off. As a result, then, all the businesses downtown, their businesses dropped because the restaurants were closed. And I suspect by the time you think about all the money that's been spent by the city, all the business that's been lost and the tax revenues, it's probably going to cost our community several $1 million by the time it's all said and done.
I also understand, we stopped in at Adams State College, that the first government entity to come in when it was clear there was some kind of salmonella outbreak was the Department of Homeland Security.
Yeah, that is correct. And I think in some respects, well, the Department of Health is sort of tied to that. And I guess in a way this is sort of a homeland security issue, if you would, because the security of the people of Alamosa was in danger. And I think they're trying to kind of tie those two together. That's probably how that happened.
They weren't concerned about Al-Qaeda in Alamosa.
No, we're not concerned about Al-Qaeda in Alamosa. But, you know, the FBI was there. You know, I think in these days, these times and days, I think people are just so paranoid, that's the first thing that comes to their mind.
Well, Dr. Rocky White, I want to talk to you about the healthcare meltdown and about why you are taking on single payer as your key issue. But first, we're going to break, and we're going to break back in New York, live in our studio, Sarah Thompson.
Rulers of the nations, as you fuss and fight over who owns this or that and who has the right to design, build, sell and store and fire all the bombs and guns to defend your holy empire. There are children, hungry children, sick and dying. There are mothers, fathers, sisters, brothers crying. They're only pawns in your play of power and corruption. Slowly starve them, your new weapon of mass destruction. And prove to me, America, that you care. Prove to me, America, you're aware. Who's dying for your freedom in this land? Who pays the cost for the liberties you demand? Is it for freedom or our comfort and convenience? Is it to profit for big business we pledge our allegiance? Are we prisoners?
Sarah Thompson singing live in our Firehouse studio. Is it for freedom? This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman. We're broadcasting from Denver, Colorado. Our guest is Dr. Rocky White, an advocate for single-payer health care with an unusual background. Dr. White, why don't you talk about that?
Well, Amy, I grew up in Nebraska, and I came from a very conservative background, an evangelical background. All of my family members, you know, everyone was Republican, very conservative. And when you grow up in that environment, obviously that's just something you just sort of adopt as you get older. After I went through medical school, I intended on going back and practicing medicine in a rural area, and that is eventually what I did. I practiced in western Nebraska for a few years, and then ended up in southern Colorado going on 13 years ago, down in Alamosa. I joined a for-profit fee-for-service organization down there, and you know, of the 23 physicians that were my partners initially, it was a very conservative group. I mean, this was a fee-for-service group, hardworking. We had one Democrat in the whole group, so that tells you, you know, where we were at, where we stood politically. But during the 4 or 5 years, well, actually, when I moved to the Valley, there were 11 full-time practicing internal medicine specialists at that time. That's what I do, is practice internal medicine. Just to make a long story short, through the course, as the years went by, as we kind of entered into the new millennium, we started hitting on some very difficult times financially, and eventually we got to the point where we were just